New COVID-19 cases and hospitalizations continue to drop in Utah, but the virus remains a threat to our healthcare systems.
This new specialist Jed Bowles shows us health experts from the University of Utah are advising all of us to be wise as we manage the risk going forward.
Masks are still mandatory when you go into the hospital or board a train or board a plane. But COVID restrictions are easing quickly, and we all need to learn how to manage our own risk.
And while things are decreasing, we still do have COVID-19 in our hospitals.
Hospitals remain busy with direct and indirect impacts from COVID. Case counts dropping 50% since the end of January, but Utah is still seeing rates of infection higher than what we experienced with the Delta variant last fall.
So I think we know that COVID-19 is a risk. How do we mitigate that risk and when? It really depends on our risk level.
Hospitalizations have also dropped nearly 50%, but there are still more than 500 people hospitalized, which is just as high as the previous two peaks in the pandemic.
COVID might be waning in our community. We still do see effects here in the hospital. We appreciate our community doing the best they can to help take care of us, and we will continue to serve.
Right now, no new variants of concern emerging. But as long as COVID-19 is here at some level, those at high risk will want to take precautions.
Particular waves, it might make sense to continue to make the choice to use high-quality masks to protect yourself. And there will be other times when cases are quite low where you can not have to worry too much about that.
Use judgment. If something makes you concerned, mask up.
But it really is going to come down, I think, from this point forward to personal risk calculations. I think personally those tools will still have an important role to play at times when circulation of the virus is high.
The health experts say vaccines and boosters are still the best protection.
I think it's an individual choice, and we have tools at our disposal that we can be thoughtful about how to use.
If you or others around you are at high risk, the doctors recommend still masking up and keeping your distance. For KSL 5 News, I'm Jed Bowles.